Hi everyone, welcome to tonight's MHTV. We're really looking forward to having a chat tonight with Dr Rob Baskind, who's an independent consultant psychiatrist and specialist in adult ADHD. So tonight we'll be talking all things adult ADHD. Nicky is going to be doing social media, so I'll hand over to Nicky for a minute to explain how you can join in tonight, and then we'll go straight into the chat.
Yeah, we really want to hear your ideas, opinions, and questions. So if you're on Facebook Live, just type away for us in the box at the bottom. We'll catch up and we'll feed your questions in. And if you're contacting us via Twitter, use the hashtag MHTV and we'll see your question. So we look forward to hearing from you. Thanks, Vanessa.
Okay, thank you. Okay, so tonight, we're talking about ADHD, which is very much in the press, isn't it, at the moment? And there seems to be a massive surge in awareness around ADHD recently. But I'm aware that there might be people joining in tonight, Rob, who don't know very much about ADHD. So perhaps if we just start by you introducing yourself and then maybe just talking a little bit about what adult ADHD is.
No problem. Thanks, Vanessa. So, hi everyone. I'm Rob Baskind. I'm a consultant psychiatrist. I've worked as a consultant psychiatrist for quite a while now, working in the NHS from until just recently. Actually, my first consultant job was actually working in prisons, and it was in prisons where I first kind of got interested in ADHD, and I then set up the Leeds NHS Adult ADHD service, which still runs. Yeah, I'll just give a bit of an overview of adult ADHD then to start with. So for those that don't know, ADHD stands for Attention Deficit Hyperactivity Disorder. I think most people probably have heard of the words ADHD, and I think many might still have the opinion potentially that ADHD is what stereotypically, I guess, was regarded as a kind of naughty boys kind of problem and a behavioural difficulty. But we understand a lot more about ADHD, and that ADHD certainly is a lot more than that. So we regard ADHD as, I guess, a neurodevelopmental condition, which is a condition which you're born with. It's the way our brains are wired, and it manifests in a number of different symptoms and behaviours, starting in childhood. And we need to be able to identify, even in assessments for adults, that children had symptoms and behaviours as children. So the typical symptoms would be difficulties with focusing and concentration, regulating attention, organisation of day-to-day life, being very easily overwhelmed, being very forgetful, being very easily distractible, and also often physically restless, needing to be on the go all the time. As individuals become adults, often that physical restlessness becomes much more problematic and manifested as a mental restlessness. So difficulties with brain switching off and multiple thoughts constantly, often making an individual very exhausted, and also get impulsive symptoms and being impulsive in behaviours and impatient in conversation and waiting a turn. And we also understand that ADHD is very much associated with difficulties regulating emotions, often very quick changes in emotions, and lots of challenges being able to tolerate change and tolerate frustration, and be able to manage criticism, actually. And individuals with ADHD are very prone to feelings of rejection and feeling extreme emotions at points of kind of criticism or challenge. So in essence, that's what ADHD is, and it I guess it affects multiple areas of someone's life, from education, occupation, substance use, relationships, finances. So really, it's a condition that affects almost every facet of someone's life, often, which is why it's something that's so important to pick up and identify early, if possible.
Yeah, there definitely seems to be a shift, doesn't there, in the landscape around ADHD? Because just thinking back, I was a child in the 80s, and ADHD, I can remember even back then, was seen as just characterized by hyperactive children, and there was never really that much discussion about how that might present in adults. And now I look back on my career, and when I was qualified in the 90s, and I think of how many people I worked with who possibly were misdiagnosed with other mental health conditions, and possibly it was ADHD that was the root of the issues for the person. So do you think that that kind of diagnostic landscape's changed? Because I do. When I reflect on my career, I think that things have really shifted.
Yeah, no, I think that's very true, Vanessa.
Mm.
I think, yeah, I mean, we saw a lot of people in our clinics who had been given other diagnoses and earlier,
Mm.
so maybe anxiety or professional personality
Yeah.
difficulties, but the ADHD had often been missed or not thought about. I do think that we've still got quite a way to go to raise awareness further, especially in health professionals. To be able to recognise it and not be making those misdiagnoses, I guess, and making sure that people are getting the right approaches and the right interventions at the right time.
Yeah, I agree. And in terms of childhood ADHD, is it always the case that that leads to adult ADHD? Because I think just looking at the past children who've been diagnosed with hyperactivity, I wonder if they've then gone on to have any support as an adult for ADHD, whether that link's been made. Is that the case, or
Yeah,
is
so
that
it's only really over the last kind of 10, 15
yeah,
years, really, that people have really kind of started taking it seriously, that children become adults, and the idea that suddenly ADHD kind of magically disappears on your 18th birthday is thankfully a thing of the past in the main, although I still hear it sadly. But yeah, the research suggests that at least 2/3 of individuals with ADHD as children will continue to meet criteria for ADHD as an adult and continue to kind of suffer challenges and impairments. And I mean, possibly that's even an underestimate. That research is quite old now, actually.
yeah. And in terms of, you mentioned at the beginning when you were describing ADHD, there's inattentive ADHD, isn't there? And then there's a more impulsive ADHD. Could you tell us a little bit about the differences?
Yeah, so a lot of people kind of still use the term ADD, which was what ADHD was called some time ago. So ADD isn't a kind of recognised category anymore, but what it really means is ADHD, which is just inattentive. So you're more likely to just have inattentive symptoms, such as the kind of challenges with regulation of attention and organisation, distractibility, and things like that, without the hyperactivity. It's quite unusual to see somebody who's just got hyperactivity without inattention, but we do see many people who have both the inattention and the hyperactivity. So we regard that diagnostic category as being a combined type of ADHD.
Okay, yeah, it's interesting. And are there any gender differences with ADHD in terms of sort of prevalence, diagnosis, and maybe how it presents as well in the different genders?
Yeah, no, it's a really important issue and very topical and relevant at the moment. Yeah, the research suggests, in terms of diagnoses, that males are much more likely to get a diagnosis than females, around 3 or 4 to 1. But that narrows significantly in adult diagnoses, which strongly suggests that we're missing girls, and that's for many reasons. Some of it being the kind of stereotypical myths around how ADHD presents, in terms of the kind of naughty boy stereotype, and girls can often be very much masking symptoms, much more likely to mask their symptoms and internalize difficulties, and which often can then present in other mental health challenges such as anxiety and depression and eating disorder behaviours. So it can often get missed because of that. And if they're not causing significant disruption, then it's not something that's often considered. And if they're daydreaming and finding it difficult to concentrate, that's often not kind of picked up.
Interesting. Nicky, any questions at this point?
Yeah, there's somebody saying, well, no, actually, what it is commentary saying, I didn't realise that. I didn't realise there was a gender imbalance. How do you get diagnosed? There's another question that's come through.
I was going to ask that next, so that's timely.
June.
Yeah, that's a $1 million question at the moment. With difficulty in the main, unfortunately. So what's kind of happened in the landscape over the last kind of 10 years? So, I mean, I started my service in 2011. And we were one of quite a small number of services actually in the UK diagnosing, assessing adults for ADHD. Since then, there's been kind of quite a dramatic increase in services, which is great. But alongside that, there's been an even greater dramatic increase in awareness and demand. So as ADHD started being talked about in the media, and there's been lots of kind of celebrities and so on that have talked about their own ADHD. This has driven up demand as people understand it more. And so services are, in general, are actually getting very kind of blocked, really, in terms of being able to offer timely assessments, and waiting lists are sadly increasing. I think it does vary depending on where you are in the country, and I feel that kind of potentially creates a postcode lottery a little bit in terms of where you are and what pathways are local. So I would always recommend that you see your GP and discuss it and inquire about the local services. But what we're finding is a lot of people are finding very long waiting lists in the NHS, which sadly kind of leads to people looking elsewhere and privately for assessments.
Yeah, it's a shame, isn't it? So it's double-edged sword, isn't it? So increased awareness is great, but then on the other hand, it leads to much more increased demand, doesn't it, on the need for people to be diagnosed. And just what you were saying there about celebrities, I think that reflects mental health culture overall, doesn't it? Because we see some sort of people with high functioning ADHD possibly, and I'm just wondering, is it a continuum like other mental health conditions where the people with ADHD who are functioning quite well, maybe finding jobs that sort of fit with their ADHD in terms of not having to do have deadlined kind of jobs, and then people who are really struggling to work, and ADHD is maybe more of a disability for some people than it is for others.
Yeah, no, absolutely. It really ranges in terms of its impact. And I think sometimes the high functioning side of it can be a little bit misunderstood as well, because I guess high functioning often is understood as being kind of related either to your IQ or to having a job. But we know that individuals who on the surface appear to kind of be very successful actually are experiencing significant difficulties. Either within the job or within kind of managing kind of home life and relationships. And so, but an important part of ADHD is also recognizing that there's a lot of kind of positive strengths that people have with ADHD. So, being able to think outside the box, being kind of energetic and passionate and driven. So we see like a lot of comedians and sportsmen and successful businessmen who have channeled those strengths or have got the support to be able to use those strengths to their maximum, who are very successful, probably as much because of their ADHD as much as anything else, actually. So it's important to see that side of it.
Yeah, it does seem like there's a lot of creative people who talk about having ADHD. Certainly, I've noticed that. So it's interesting. That kind of reflects what you've just said, really, doesn't it?
Yeah, definitely.
Yeah, yeah. And so we've talked about how to go about getting a diagnosis. What does the sort of diagnostic assessment involve for ADHD for somebody who's
So kind of appropriate ADHD assessment should involve a face-to-face appointment or video appointment, at least an appointment with the person. It should involve collection of information from significant others. So that's usually trying to get information from a parent to understand the observations of the person as a child, and usually someone who knows them in adulthood, so often a partner or a friend or somebody like that. And it involves kind of understanding that person's background history, their mental health history, because it's really important as part of the criteria to be able to exclude that any presentation of symptoms could be explained by another condition. And then usually going through a kind of diagnostic schedule or interview of specific symptoms that you're trying to assess whether the individual kind of meets, which would satisfy the criteria.
Yeah. Yeah. And you mentioned about excluding other conditions. Another thing that I've noticed a lot sort of on social media recently is the link between autism and ADHD as well.
Yeah, no, absolutely. It's a very strong association. There's both overlap of symptoms, but also a high degree of kind of coexistence as well. So we see a lot of people I see a lot of people who have ADHD who either have a lot of traits that would be consistent with autism or actually, the full kind of autism package, as it were, which can make it challenging sometimes because there's some symptoms of autism which kind of directly conflict some of the symptoms of ADHD, such as the need for order and routine against the ADHD more disorganized nature. But it's interesting, but it does add complexity and greater challenges, I guess, for the individual, especially kind of in social kind of relationships and communication.
Yeah. And in terms of treatment for ADHD, what's available that helps people who are living with ADHD?
Yeah, so I mean, often, what adults will get offered would be medication. Medication is licensed for the treatment of ADHD in adults and often recommended as one of the first approaches. I think it creates challenges in itself because the more people that are diagnosed, more potentially people might be on medication, and medication can be very effective, absolutely very effective in terms of helping support people. And many people have kind of fed back that it's been life-changing, and it's really helped them in their life, and their mental health, and their relationships, and their parenting, and other areas. But it's really important not to think of medication as a kind of one kind of size treatment, as it were, and to really kind of look at the other parts. So getting some help with structure and organization and some coaching can be really effective and helpful. Some talking therapy can be very helpful, because often people with ADHD, they've had quite a traumatic life often in that they've found it difficult to succeed. They've often kind of received a lot of negative comments from those people close to them. They've struggled to keep jobs and relationships and so on. So it's important to kind of have the support, and sometimes that involves kind of educating family members as well, because it can be quite difficult also for them to kind of understand the family member's ADHD and how that presents. And but that raising awareness can be incredibly helpful to the person, but also the family in terms of, being able to reduce conflict and improve communication, I guess.
Yeah, definitely. I love the ADHD Love account, is it? That they do a lot of reels about, it's from the partner who's talking about
They've recently written a book, haven't they? I think.
Dirty
Laundry.
Yeah. I think they're great though, aren't they? It kind of humanises it, doesn't it? And
absolutely.
The sort of challenges that people experience. Yeah. Nicky, anything from you at this point? I know I've got a lot of questions. So
there's a question about someone just looking for clarification on when talking about gender, are you saying that more men have it than women, or that we just see it in men more?
I'm suggesting more men are being diagnosed than women. I think the prevalence is probably very, very closer together, actually.
Yeah.
Someone asking, is this new or has this always been with us? Which is suggesting that you have an epic knowledge of prehistory, I guess. But is this something that's developed, or is it something we've discovered? So that was the question.
No, I think ADHD has always been about. We've actually got descriptions of what's very ADHD like in medical literature going back to the 18th century. So it's like anything. It's until people understand it and put the construct together and raise awareness about it, then it clearly becomes more common. And we've seen that with lots of medical and mental health conditions, and that's just. I'm sure it will continue to be the case that we'll kind of discover more about these things.
Yeah, and I've got another couple of questions asking about how to help, but I guess it makes more sense maybe for you guys to think about how this relates to sort of criminal justice system, because it's forensic setting they're talking about. So maybe that would be the next step to think about.
Yeah. Okay. Well, I know we mentioned, Rob mentioned at the beginning that your sort of interest started with ADHD, didn't it, in prisons, and obviously people know that I work in prisons as well, and certainly we do see a high prevalence of people presenting with ADHD. So it's quite useful to talk about why. Maybe start with why there's such a high prevalence in prisons. Why is that? Is that presentation of ADHD in terms of impulsivity?
Well, I think if you look at the kind of way that ADHD impacts someone's life, so it potentially impacts their ability to complete education. It might make somebody quite impulsive and restless in a school environment, which might lead to suspension or exclusion. It might lead to people finding it difficult to form relationships and peer relationships. People with ADHD are more likely to start using substances earlier to try and either self-medicate, or because we often find that they're actually more likely to associate with older peers and be quite suggestible and risk-taking in their behaviours, more likely to have relationship difficulties and other health challenges. So I guess when you put that into the mix, then we can understand why that might lead to an individual kind of getting involved in offending behaviours. And then, as we know, and as you all know, once someone's within the cycle and within the system, it can be very challenging to break out and learn the skills to then function back in society. So I think that's why we see so many, and the statistics suggest that up to 20 to 25% of prisoners would meet criteria for ADHD, which is quite scary, really.
Yes. Yeah. And is that, I know we've talked about gender, but is that across the male and female estate,
The rates seem to be higher in males.
That reflects
proportionality, we probably have more male offenders anyway, don't we see? But yeah, and so that's kind of that's kind of what the stats are showing at the moment.
Yeah. And in terms of prisons, what can we do you think, to improve the care and support that's offered to people in in prisons. And I know that's a massive question. I'm just thinking that one of the challenges I hear from practitioners is when they're seeing someone with ADHD that they don't have a sort of specialist understanding of ADHD, and sometimes I think people are scared to know what to do to help someone. And one of the messages that I've been given is around just working with someone in a person-centered way and understanding what their issues are, and how that affects their day-to-day functioning, and then working from there.
Yeah, no. It is challenging. I mean, when we talk about statistics such as kind of 1 in 4, then that's very scary from a resource and capacity to be able to support that many people. I think that the first thing is definitely raising awareness within healthcare staff, mental health staff, about ADHD, but also within the criminal justice staff as well, because it can really impact the interactions that they have with individuals with ADHD, if they understand it better and understand that actually there's kind of more effective ways to communicate, than maybe it's kind of been traditional in a kind of offender establishment. So I think that's certainly the most important thing, is kind of raising awareness. And that's really important for the prison themselves, because often they feel very misunderstood. So actually, if they can feel a bit more understood, that goes a long way too, I think, in terms of helping support them. And I guess it's always difficult, because people talk about it, needing kind of a specialist knowledge and specialist service, but actually it's a very common condition relatively to many other conditions that are treated. So in adults it's like 4 to 5%, which compared to many other mental health conditions is kind of 3 or 4 times actually. So we should probably be less talking about it as a specialist condition, as a common condition that needs to be that people need to understand. So just kind of maybe normal part of doing mental health work, rather than kind of seeing it as something kind of special and separate, I think would be kind of really helpful, because often it's assessing and diagnosing someone with ADHD is actually more often than not fairly straightforward. And once you take away the kind of mythical part of it, it really is kind of fairly straightforward. So, I don't think it takes much to improve services, but I think there's a fear because of the potential numbers. I think that always kind of creates a fear and a barrier to kind of facing up to it, as it were. And it's easier to bury heads in sand, I think, sometimes.
Yeah, I think so. I think as well, there seems to be a move towards people self-screening and self-identifying as having ADHD. And sometimes I think people get hung up, I don't know if this is your experience as well, on somebody needing a formal diagnosis of having ADHD to actually support, rather than supporting someone who self-identifies as having ADHD. And I guess as it gets more and more difficult to get a diagnosis of ADHD, we might see this happening more and more, mightn't we?
Yeah, no, it's a difficult challenge at the moment, because I think because so many people are kind of raising awareness and self-identifying, and most people who come for assessment, whether it's in prison or outside prison, often people who have read about it or someone suggested it to them, often not a healthcare professional. And I think there's always a bit of a fear about people kind of self-identifying with mental health conditions or those conditions. And that really does a disservice to the individual themselves, who've often done a great deal of research actually into kind of trying to understand themselves. And it's really important to take it seriously and not dismiss. I think a lot of professionals in time gone by have dismissed the idea of someone being able to kind of explore themselves, what's wrong with them, and be able to present it to a professional. But I think it's something that has to be taken very seriously. It certainly doesn't invalidate, their experiences.
Yeah, yeah. The other thing that I wonder about really is as more and more people are diagnosed and as there's more awareness, whether we'll stop seeing it as sitting within mental health or being a condition at all. And, we'll start to see that actually some people are neurotypical and some people are neurodiverse, and that's the way of the world, whereas at the minute the world is designed for people who are neurotypical, isn't it? So people who don't fit into that bracket struggle because they're masking, as we said earlier, to kind of fit into a world that doesn't understand them.
Yeah, absolutely. To be honest, when I see patients now, I describe to them that they've got neurodiversity, they've got diversity, as with any other diversity, whether that'll be kind of gender, sexuality, race, culture, and they're not ill, they haven't got an illness, they've just got a difference, and that should be a lot of the time embraced. But you're absolutely right that the main challenge is that people with whether it's ADHD or autism or dyslexia for that matter have is trying to fit in to the this neurotypical world, and that is almost universally what actually leads to the experience of the other mental health difficulties like the anxiety and the low mood. So it's not something intrinsic about the condition itself. It's the effect of trying to manage those symptoms and conform, I guess, in very challenging environments. And prison is an absolutely great example of that. Idea of someone with ADHD who's very restless and hyperactive, of kind of being able to manage in a very, very small space, very, very limited time outside a cell, very limited time for exercise, expected to queue continuously for very important treatments, is really, really challenging, and it's it's almost directly challenging their difficulties.
There's a couple more questions come through. One person who's just sort of saying how helpful this is, but they haven't really thought about it in terms of forensics, and they're saying, is there a link to suicide, because it must be really difficult to have that experience and be in such a controlled space. And another person coming at this from a completely different area said, some people argue that ADHD isn't a thing. Can you talk about why people say that and why you don't think it's correct? So two very different. There's no way you're weaving those two together. So,
okay, I think I'll start with the second bit and then move on, because I think there'll probably always be kind of some kind of skepticism about ADHD for whatever reason. I think people don't like the idea of labels. People don't like the idea of kind of looking at the way someone behaves or presents and thinking there might be an explanation for that isn't just their own willful willfulness to behave in a negative way. But why is it a valid condition? Well, we probably have more scientific peer-reviewed papers around ADHD than almost any other mental health condition. We've looked at rates across the entire world, including areas of Africa and Asia, and ADHD is everywhere. It's not the symptoms are very consistent wherever you look. So it's absolutely kind of a valid kind of condition or construct or diversity or whatever we want to call it. But yeah, it's absolutely valid, and telling somebody who's had such negative experiences that your experiences aren't valid is bordering abusive, I would suggest, actually, and very much gaslighting. So I think we need to move very much away from that. In terms of suicidal risk, ADHD does increase suicidal risk. It reduces mortality as well. There's a really good study that's been done, I think, in Denmark, and it kind of demonstrates that if you have ADHD, you're more likely to die younger. which is obviously really significant. But yeah, in the prison environment, I sadly had individuals in prison when I was there who did end their life and had ADHD. It's a very, very challenging thing to manage if in such an environment. And if you don't think people are listening to you, and your mind is so restless and racing, and it's a very challenging area to be in.
Yeah, people not getting the medication on time and things like that because of the restrictions of the regime are hugely challenging for people, aren't they, in a prison context? And I guess someone not having ADHD or not understanding ADHD won't appreciate why people are so fixed on needing to have the medication on time, because they know that that's what's really helping them to manage the symptoms and manage the time in prison.
Absolutely. Yeah, no, I had that. I experienced that quite a lot when I was there, and what's really nice sometimes is that when you can persuade the authorities, whatever, to ensure that people do get the medication when they need it. The officers and the other staff see the response really quite quickly and appreciate the response, and that they're able to engage with the individuals much more effectively. So it's kind of a win-win for everybody, really.
Yeah, absolutely. And we had psychologist on, didn't we, Nicky, recently from Pentonville, because they've developed a specialist neurodiversity unit, and I think reflects everything that we've said really around training up not just mental health staff, but also having that whole prison approach, so the prison officers understand neurodiversity and can support people, and have been actively recruited because they want to work with people who are neurodiverse. So, because I think often it does seem to me that it gets kind of pigeonholed into mental health, and really ADHD isn't a mental health condition as such, as it's much wider than that. So, and I suppose the question about whether ADHD exists makes me think about the discussions around ADHD and trauma, whether ADHD is actually trauma, or whether people with ADHD have experienced trauma and go on to develop ADHD because of trauma, or whether it's just the case that, like with the general population, there are high levels of trauma, and when you kind of talk to somebody and kind of delve into the past, there's a history of trauma that might not actually be related to ADHD. So I don't know what my position is on it. So I'm wondering what your thoughts are really around the link between trauma and ADHD.
Yeah, there's certainly a kind of a quite active debate about it.
Yeah.
My thoughts are kind of similar to what you were just saying. That experience of trauma is not uncommon, sadly. Having ADHD in itself, it can often be a trauma. And it's also important to acknowledge that we know that ADHD is very heritable. So it's highly likely that one or sometimes both parents might have ADHD, and it might be severe ADHD, and highly likely to have been unrecognized, which might mean that a parent may have had other difficulties such as substance or alcohol use, and so and relationship difficulties. So the potential and risk for trauma is increased as a result of that. So and also individuals with ADHD can be easily led, and we know that can be a factor in abuse, for instance. So I think we can't. It's not always that easy to differentiate, but I think what's important is not to kind of be creating kind of a line down the middle with it, where you've got to kind of land on one side or the other and be mutually exclusive. That you can have ADHD and trauma, and it's important to approach both areas and provide the right interventions. And for instance, for individuals who who might have significant trauma and need, psychotherapy, for instance, but may have ADHD as well. Actually, treating their ADHD can improve their outcomes in therapy. If they're able to concentrate better and be able to sit for longer and so on, and have greater self-awareness and executive function, then that can help that.
Yeah, and I suppose it's about the therapist having that understanding, isn't it, as well, of neurodiversity, and being able to adapt an approach so that the person feels able to, work within that framework. And I guess, what we were saying earlier about, living in a world one day, hopefully, where, neurodiversity is just kind of a different way of looking at the world to the sort of neurotypical. But I'm wondering, in the here and now, are there any quick wins for organisations, for example, and teams, when they're not only, working with people clinically, but also, our staff who, certainly many of our staff likely to have neurodiverse conditions as well. What can employers do to better support people with neurodiversity?
I think
that's a question.
It's a big question.
Yeah.
I think acceptance of recognition, understanding the challenges, and and at the end of the day, if individuals with neurodiversity would work better with certain adjustments, then I think employers, whether it's in mental health or out kind of private world and business or whatever, it's in their interest actually to be open to providing those adjustments, because you're more likely to get a productive and happier workforce. So and that's the feedback actually that you get when that happens. So really pulling out the strengths of your neurodiverse employees and enabling them to channel those effectively is really positive for whichever service that is. So no, absolutely, and I agree with you. I think probably a number of individuals working in kind of the offender establishments probably have kind of neurodiverse conditions, and I think it's one of the strengths of having those conditions actually, that you want to help and support and care for those individuals.
Yeah, absolutely. Well, we're coming to the last 5 minutes, and Nicky, I was thinking if we go over to you first for any final questions and thoughts, and then come back to Rob for any final thoughts or anything that we've missed.
I've got a great question here, which to me totally looks like someone's fishing for an essay answer, which I always really admire. Is there anything big coming up in the world of ADHD?
That was the question.
Yeah.
Wow.
I just admire them.
I don't know. I won't be told, but I mean, I think it's just. I think ADHD in general is a very, very topical area at the moment. In health, in business, in just society. So and it's all over social media. So just keep up to date with that, because you'll find what's going on.
Yeah, thank you very much. I have to say, I hadn't really put it together with the criminal justice system, but it just makes total sense. And I look back on all times in forensics and even in open wards and stuff, where you just think, oh, you missed that. So it's really good to hear it. Thank you very much.
Yes.
Next week, by the way, we've got Reclaiming Mental Health Education, what it should and could look like and how to get there. And that's, I think, Dan Warrender and Stephen Williams. So thank you.
Thank you. Okay, so Rob, over to you then. We've had a really fascinating, in-depth discussion tonight, I think. But is there anything that we've missed, or any final messages before we wrap up for people who are listening?
Yeah, I think my message would be to kind of be open and curious about ADHD. I would suggest to everyone who's watching that it's highly likely you will know someone, whether it's a family member or a friend or someone you work with, who has ADHD, whether diagnosed or not. So read up about ADHD, kind of be open to it, and empathic to individuals that you see with ADHD. And the other thing I would say, we're always looking for people to work in ADHD, and then it's an incredibly rewarding and satisfying area to work in. So, keep that in mind.
Yeah, it's brilliant. Well, it's been a pleasure having you on tonight. Thank you. It's been really interesting conversation. Yeah, thank you. And we'll wrap up there, shall we? So thanks for listening, everybody. And we'll say good night.
Bye.